Awesome. Hi, everyone. Thanks so much for jumping on. The topic for our live stream this morning is again on AMH. This will be part 2. We did cover part 1 yesterday, so we'll just get straight into the questions. My first question for you, Dr. Rusty, this morning is, why do women with PCOS have a very high AMH?
Okay, so really the AMH level and how long women stay fertile in terms of the egg reserve depends on how many eggs they're born with. Yeah, so if women born with very high number of eggs, and they stay fertile longer and they have a late menopause. If women born with a low number of eggs, they lose their egg reserve quickly and they can have a premature ovarian insufficiency, early menopause. So, and that's genetically determined. So there's a gene which is responsible for number of eggs, creation of eggs in the ovaries. So all the eggs are created before women are born. After the birth, women cannot create eggs. Unlike men, in men, they can keep creating sperm throughout their life, but women create the eggs before they are born, and they only can activate and spend those eggs. So if a woman born with a very high number of eggs in their ovaries, so they have a very high egg reserve, which can be measured by AMH and antral follicle count, AFC. And this is a group of women who have a PCOS later on. So after they go through a first menstrual period during teenage years, then gradually they develop PCOS because they have a very high reserve, lots of follicles any given time on their ovaries. And when you scan, you can see more than 20 follicles in each ovary. You see more than 40 follicles generally. So, and those follicles keep producing AMH hormone, and that AMH stops them from ovulating. So like we said yesterday, AMH has got 2 roles. One is to stop activation of sleeping eggs. AMH preserves your fertility until the age of menopause. And the second role of AMH is to stop ovulation of multiple eggs every month so that one egg gets ovulated. This is the second role, is responsible for anovulation in PCOS. So how it does, so this is why women with PCOS, when they're young, let us say in their 20s, with severe PCOS, they do not ovulate. And they have period every year, maybe every 6 months. If you measure their AMH, it's very high, like 70, 80, maybe even more than 100 picomoliters. And when you do scan, they can have 60, 70, 80 follicles on their ovaries. So what happens is once their egg reserve drops, because they're getting older, naturally it drops for everyone. So once this tide of follicle number and AMH drops, then they start suddenly ovulating. Yeah, some women, depending on how much of egg reserve they had to start with, some women start ovulating at the age of 25, next one 28, 30, 35, 40. Some women start ovulating with PCOS after the age of 40. Paradoxically, if they try to conceive naturally, they are more fertile when they're older. So older women get less fertile as they get older because their egg quality egg quantity drops. PCOS patients, if they don't use any fertility treatment, if they just wait to have a natural conception, they start ovulating later. Yes, their egg quality drop, but compared to their previous fertility, when they were not ovulating, they become more fertile later. Why? Because they start ovulating. Why they start ovulating? Because the AMH drops. Because the antral follicle number drops, then they start ovulating. So women with PCOS have a high AMH because they were born with a very high number of eggs on the ovaries, and then those eggs, like we said yesterday, if you have a high number of follicles in sleeping eggs, you have high number of active follicles. We call preantral and antral follicles. Those follicles produce AMH, and then they have a high AMH levels. So PCOS women are the women who have a very late menopause. Everyone heard women menstruating until the age of 60. Some women have a menopause as late as maybe even at 65. So these are the extremes of PCOS women who are having menstrual period even like at the age of 60. Average age of menopause is approximately 51, 52. So anyone who has a menopause after the menstrual period after the age of 55, these are women who are born with extremely high number of eggs. Then they develop PCOS later on, and they have a very late menopause. So I will explain how AMH stops ovulation. So there is something called AMH FSH barrier. So what happens is the follicles we call antral follicles, when you do AFC scan, you count those follicles, produce AMH hormone. If you have very high antral follicles, let us say you have PCOS, your antral follicle number is 60 and your AMH level is 85. So you have got so much AMH in the system. So what happens is every month your pituitary gland, the gland on the base of the brain, produces all the time two hormones, FSH and LH hormone. The role of FSH hormone is to stimulate those follicles to get them through activation to growth stage. Growth stage means more than 10 millimeters. Any follicle smaller than 10 millimeters is called antral follicle. A millimeter is called antral follicle. So under the influence of FSH, so the one of the follicles should get bigger than 10 millimeters and should ovulate. So once it becomes 16, 17, 18, 19, 20 millimeters, then LH, second hormone of pituitary called LH, gets released. You have very high LH levels, which is ovulation hormone. Then it breaks that follicle and ovulation happens. So if you have a normal level of AMH, normal number of antral follicles, normal level of AMH, so let us say your AMH is like normal, which is like 20, for example. So you have got approximately 20 follicles, you have AMH is 20. So when pituitary is producing FSH hormone, which crosses the barrier of AMH easily, which means it selects one follicle, that follicle grows and your pituitary produces LH, you then have ovulation. When your AMH is so high, which means your antral follicle number is 60, AMH is 85, so you produce FSH normal level, it cannot reach that barrier. So AMH suppresses all the follicles, so it cannot select any. Then FSH drops. Then LH cannot. LH stays high. Women with PCOS, it stays high. LH is also trying to cause ovulation, but it cannot reach that level. Why? Because the estrogen is not being produced in high levels from the selected follicle. So that's as a result, you have anovulation in severe PCOS. If you have a severe PCOS, you have anovulation, which means you may even amenorrhea, which means you don't have even menstrual period for 6 months. If you have a little bit lower egg reserve, you have ovulatory PCOS, which means you have a PCOS but you ovulate. So then once it drops, even PCOS symptoms go away and your ovarian reserve becomes normal. Let us say at the age of 25, you had severe PCOS, you didn't ovulate. At the age of 30, you have ovulatory PCOS. At the age of 35, all PCOS symptoms gone. Now you have a normal ovulation until you have a menopause. So how we make women ovulate with PCOS is by giving letrozole or Clomid. So let us say same patient, antral follicle is 60, AMH is 85. Then when you give a letrozole or Clomid, what it does is it makes pituitary to produce more FSH, so that FSH will cross that high barrier. It doesn't drop the barrier of AMH or AFC, it stays high, but FSH increases, then it manages to select one or two follicles for ovulation. In some patients, if they have such a high egg reserve, very high AMH and AFC, even letrozole Clomid doesn't work. You keep increasing the dose, 1 tablet, 2 tablets, 3 tablets a day for 5 days, still doesn't increase FSH sufficiently to cause ovulation. Then what you do, you give them FSH drug directly, like Menopur and Gonalev, Purigon, directly to increase FSH high enough so that FSH will cross that AMH barrier and let's select, one dominant follicle or two dominant follicles. Even if that doesn't work, because if you give a high dose, then they can overstimulate. You don't want women to have 4 or 5 eggs release, at the time of ovulation induction. The next option is IVF. Why? In IVF, you give a very higher dose FSH, let us say 125, 150 units. Even if they release like 10, 15 follicles, you collect them and create the embryos, put one embryo back in, so which means they can't have a twin pregnancy or multiple pregnancies. So yes, so in PCOS, we achieve ovulation in patients who are not ovulating by giving letrozole, Clomid, or FSH, because it allows us to cross AMH barrier. So essentially, yes, answer to the question why women with PCOS have a high AMH, because they are born with high number of eggs, they have a high antral follicles. All these antral follicles are producing AMH, and that's why they have a high AMH, and they have a longer fertility, and they have a late menopause. So the gene responsible for creation of number of eggs you have runs in the families. That's why PCOS runs in the families. If you have anyone in the family in PCOS, you are more likely to have a PCOS, and you have a longer fertility in terms of your egg reserve. I'm not talking about quality and other cause of fertility, from purely egg reserve point of view. Let us say average number of eggs women born with is 500,000. We think it's we don't know exactly, but we think it's 500,000 eggs. Women with PCOS may be born with 2.5, 3, 4 million eggs in the ovaries. Women with a low egg reserve are born with less number of eggs, maybe 100,000 or 200,000 eggs. And this is why by the time they try to conceive, if they delay their plans, they can run out of egg reserve. Then this is a women who need donor eggs to achieve successful pregnancy.
Thank you so much, Dr. Asti, for such a detailed response to that question. My second question for this live this morning is, why do women at risk of diminished egg reserve and early menopause, why do they have low AMH levels?
Yes, this is like we said in the spectrum. Yeah, like yesterday we said, the egg reserve is a body parameter. Body parameter means some people short, some people have a medium height, some people are high. So this is how their genes determine, of course, other factors as well, but genes determine that their height. Yeah. So similarly, their genes, women's genes determine how many eggs they will be born with. Yes, there's some other factors, but primarily 80%, more than 80% is determined by genes. This is why if, PCOS runs in the families. This is why early menopause runs in the families. This is why premature ovarian insufficiency runs in the families, because their families, they have a gene which is responsible for creation of eggs, and that gene allowed them to be born with a less number of eggs. And if they're born with a less number of eggs, they run through the eggs much quicker. Like yesterday we said, every day you lose 24 eggs or so, which is every hour you lose 1 egg. If you have a PCOS, if you have like 2.5 million eggs, even if you lose 1 egg every hour in average, so even after the age of 60, you still will be releasing eggs. But if you're born with 100,000 eggs, if you lose 1 egg every hour, you may run out of egg reserve at the age of 25 or 30. So this is primarily determined by genes. This is why women whose moms or aunties who had the premature ovarian insufficiency in early menopause should be alarmed and immediately do AMH and antral follicle count, and to determine their own egg reserve. And they should project their egg reserve to the future when they want to have kids. Then they should know that if they have a low egg reserve, they need to have kids much earlier by trying naturally first, if it doesn't work, fertility treatment, or preserve their fertility by preserving the eggs or embryos. So the two things we need to define. Yeah. So there are three things we need to define, or 4 things even. First one is a late menopause. That's a menopause after the age of 55. So that is a late menopause. So this is the women with PCOS who have a late menopause. Then you have a normal menopause. This is it between age of 46 to 56. So average age is 51, 52, but anyone who has a menopause from the age of 46 to 56 have an average egg reserve. So then you have early menopause. That's from the age of 40 to 45. So that's early menopause. They are born with a low number of eggs. Then you have a premature ovarian insufficiency. That's when you have a menopause before the age of 40. It can even happen at the age of 25, 30. That's rare, but still women unfortunately can have a menopause at the age of 20 or 22, which is very, very rare. I don't want everyone to get alarmed. That's very rare. But overall, 1% women have a premature ovarian insufficiency. Let us say if you're in the school, you have or in the university, let us say university, you have 100 girls at the same age, one of them have a premature ovarian insufficiency statistically. So that's 1%, and 5% of population women will have an early menopause. So let us say 6 out of 100 affected. So if they are not aware, they may run out of egg reserve by the time they try to conceive. That's why everyone should be aware of their egg reserve. That's very important to do fertility screening by a couple of AMH, couple of antral follicle counts, so that you're aware. You don't have to get alarmed, just you're aware what's your actual egg reserve, especially if you have a family history of early menopause or premature ovarian insufficiency. So so that's the why this 1% has a premature ovarian insufficiency, why 5% have a early menopause, is because this is a lowest 1 percentile of women who are born with egg reserve. Let us say 100 women born with a different level of egg reserve. So when they're ready to have kids, let us say at the age of 20, if they track their egg reserve, you can see 1%, which were born 20 years ago, born with low egg reserve, have a very low AMH, low AFC, and they keep going. At some point before the age of 40, they fully run out of egg reserve and they have a menopause. But there is a time before menopause, your AMH goes down to 0, antral follicle goes down to 0, and there's a time. This time can be different in different women. It may last 1 year, and another women 3 years, the other women 5 years. So you have a very low fertility left. You're still releasing eggs. You still can get pregnant. Your AMH is 0.6. Your AFC, a number of follicles on your ovaries, 4 or 5. But this time is critical. Women should use a fertility treatment. They can try until they start the fertility treatment. If they get successful pregnancy, excellent. If not, they should use a fertility treatment to maximize their chance to have a successful pregnancy or preserve their fertility. Usually with this AMH, it's difficult to do egg freezing, but they can preserve embryos by using donor sperm or their partner sperm. So we will define the menopause. Menopause is defined by stopping period for more than 12 months, having AMH less than 0.6, and FSH higher than 30 milliunits. Yeah, so if these 3 things happens, then that means this patient is gone through the menopause. But there is a perimenopause where your periods become irregular every 3 months, every 4 months, which means you're ovulating, yes, every 3-4 months, because there's less and less number of eggs left. So before perimenopause, you have a diminished egg reserve. You have a critically low AMH, critically low AFC, and that period is unpredictable. It can last 3 years or 4 years or 1 year. It's unpredictable. So this is a critical time. This is last opportunity to create eggs or embryos or to get pregnant naturally or fertility treatment. In terms of naturally, you can try to conceive short period of time, but you should use a maximum, put a maximum effort to get as many eggs out. That's usually IVF. At this stage, it's IVF. So yeah, so this is primarily determined by genes. It's nothing to do with what you have done, your lifestyle. It's not your fault essentially. Yeah. So when we say, oh, you didn't have a good lifestyle, you didn't have a good diet, it's primarily, we think age and genes approximately determines your egg quantity and quality by 90%. Yeah. So yes, there are some factors that can impact hugely, like surgery on the ovaries. You have a chocolate cyst and you had multiple surgeries, yes, it can reduce your egg reserve. or you had a chemotherapy or radiotherapy. These things can directly impact the egg reserve, because eggs are protected with multiple layers of cells. It's not easy to impact them, their quality or quantity. Why? Because this is only cell in the body which is created before you are born and until you use them after even maybe 40-45 years. And all other cells in your body goes through the mitosis, which means you keep replicating. So your body cells you have now were not there like last year. A lot of them are new, but egg cells are there since you're born. This is why the nature created them in such a way they have to be protected. And this is why it's not easy to influence them. So their sleeping state, fully protected, be inside your pelvis. Pelvis is most protected area in the body. Inside the pelvis, it's hidden. It's not only inside the pelvis, it's inside the inner pelvis. It's fully covered, and also inside the ovary. And then you have multiple layers of somatic cells which keeps each egg protected. So and this is why you cannot activate eggs until time comes, which is determined by AMH hormone, like we said yesterday. So yes, generally women who are going to have an early menopause or premature ovarian insufficiency have a very low AMH. Let us say if someone does AMH at the age of 25, if the AMH is 3 picomole liters, almost certainly they're going to have a premature ovarian insufficiency. Why? Because within 3 to 5 years, very likely they run out of egg reserve. It's impossible to tell in each person when exactly they will fully run out. Like we said, last phase of diminished ovarian reserve can be different in different women and can last long or short. That's we can predict until the age of 0, AMH of 0.6 and AFC of 3-4. Then from there, we cannot predict exactly. But essentially, the main opportunity women have is before their AMH drops in such a low level, or egg reserve drops in such a low level, or before their antral follicles drops in such a low level. This is why I encourage everyone to be aware of their egg reserve, your AMH and antral follicle, and track. You don't have to do it every year. If you have high AMH, you have PCOS, you can do AMH once every maybe 5 years or 10 years. You have average egg reserve, your AMH is 20, you can do AMH after 3 years, because we know how it declines. It's very predictable, it declines very slowly. But if your AMH is very low, you need to track and keep updating your fertility plans, natural, egg freezing, embryo freezing with partner sperm, embryo freezing with donor sperm, as soon as you have an opportunity to have a child. So essentially, you should stay on top of that AMH. So you have AMH curve, you have your fertility plan curve. If your fertility plan curve is falling behind AMH, let us say AMH is dropping here, like by the age of 35, and you are making fertility plans to have a baby at the age of 38. So which means that your fertility plan curve is not agreeing with your egg reserve curve, which means you need to get eggs out and then make sure that your reserve egg, frozen reserve, matches your fertility plan. So this is why you have to be aware. So our job as a fertility specialist is not only treat patients who come through the door. Yes, that's our job. But another job is to educate public so that they don't need this treatment. They can conceive naturally before it's too late. Yes, so this is one of the reasons premature ovarian insufficiency and early menopause we have to be aware of, and that's genetically predetermined. Nothing to do with your fitness, nothing to do with your diet. That's genetically predetermined. So this is why you may be very fit. You say, I know my body, I am fit, I don't need to worry, I know my body. Yes, but you don't know your genes. You know your genes by doing AMH test, antral follicle count. Maybe 2-3 times you establish your reserve. Okay, my reserve is good, AMH is 20, you don't need to worry. But if it's low, you have to be very proactive in terms of making plans.
Thank you, Dr. Asti. My third question is, if you have an average egg reserve, what should your AMH level be like?
Yeah, so average, so in the reserve means that you are born with average number of eggs, and when you have a first menstrual period, then you have a regular period. So if you're having a regular period, you fall somewhere in the average or low as well. In low AMH, you have a regular period. So then if you check your AMH, depending on your age, it can go down. So depending on your age, so you can be in the middle of your age. Let us say your age is 25, your AMH is 30. So you're approximately right in the middle. If your age is 25, your AMH is 20. That's lower normal. So let us say your age is 25, your AMH is 15. That's low. So so that these women who are born with average number of eggs, they have average fertility duration and average age of menopause. Like we said, average age of menopause is between age of 46 to 54. Yeah, so this is determined again by their genes. They have a genes which is responsible for creation of eggs. That's those genes are just normal. They don't have a gene which overcreates the eggs like in PCOS. They don't have a genes which undercreates the eggs before they were born, like in early menopause and premature ovarian insufficiency. They have just genes which creates normal amount of eggs.
Thank you, Dr. Asti. My final question is, you've touched on early menopause, late menopause. If a female completes their menopause, so after menopause, what would their AMH level look like?
Yes, so like we said, AMH is only produced from the growing follicles. Yeah, so menopause means you run through sleeping eggs, which means you're not creating growing follicles like preantral and antral follicles. So, and which means you're not producing AMH. So AMH is in women with truly menopause is always less than 0.6. And if you do scan, you can still see some remaining remnants of follicles. In women with menopause, if you do scan, you can see 2, 3, 4 small follicles. They're not functional follicles. They might have been just a remnant of follicles produced a few months ago, and these follicles do not have a receptors to produce estrogen. So menopause means you stop producing estrogen. So, and estrogen is also produced from the same cells which produce AMH. So if you're not producing estrogen, you're not producing AMH as well, which is produced from the follicles, sac of the follicles. So, and because you're not producing estrogen, you are not having menstrual period. So this all linked. If you have eggs, you produce follicles that produce AMH and AFC. You detect the AMH on the blood, you detect AFC on ultrasound scan, that AMH and producing AFCs produce estrogen. You detect the estrogen. Estrogen makes you to have all the estrogen symptoms. Then you ovulate, then produce progesterone, then you have a menstrual period. If you run out of eggs, then all these things stop. Yeah, so in women with menopause, the AMH is 0.
Thank you, Dr. Asti. That does conclude our live this morning. So tomorrow we will be joining again to cover part 3 of the AMH topic. So thank you so much to those that joined. As always, the screen recording of this live will be published to Dr. Asti's Instagram, TikTok, and YouTube. So please jump on tomorrow if you would like to learn more about AMH. Thank you, Dr. Asti.
Thank you. Thanks, Gabi. Thanks everyone for joining.